certain aspects that I will talk to my patients when I'm reviewing a bone density scan. This is Dr. Chhaya Makhija, your board certified endocrinologist. So let's dive into it. Now, it's not just a report and looking at the T-scores and relying on the conclusion for me. As an endocrinologist, we look at several other aspects in bone density scan. Number one is just the images, like what's been the alignment of the L spine, that's a lumbar spine, as well as if L1 to L4 were appropriately measured. Number two is looking at the hips, if the hip alignment, the angles at which the bone density was measured in the femoral neck as well as the total hip is going to be very, very important. If there is a prior bone density, was it done on the same image? Because a comparison is more like apples to apples or oranges to oranges for us to understand if there's been a significant change or a significant improvement or decline in the bone density. The other aspects are if there is arthritis, if there's sclerosis, if there is degenerative change, especially in the spine, that may cause the T-scores or the bone density numbers to appear to be higher, which is actually false. So those things are also kept in perspective. Then there are several other risk factors that we tend to assess during our clinical discussion, as well as a review of your medications, review of your history, as well as prior lab results and what else do we need to order to figure out why do we have low bone density, why do we have osteoporosis, or why do we have severe osteoporosis. The other or the last important aspect that I tend to look is can we get a bone density scan done where there is a measurement of something called as trabecular bone score. Now, every machine or every imaging center may not give this a specific number, but if I am assessing someone who has questionable bone density scores, or there is a larger impact on their T-scores, which is more negative, then I would favor a trabecular bone score, which is usually measured in the spine, and that actually looks at the microarchitecture of the bone. So talk to your healthcare professional if you are needing that expertise and a more detailed review of your bone health and bone density scan, which might help you to take preventive measures right away.